If you're just joining us now here on the platform and you are participating in Rock from the Heart, I just want to make sure that you're in the right place at the right time. It's our afternoon session. That was just session number 2 that we're going to be moving into with Dr. Courtney Jordan Baechler now. We're going to be talking about mental health and heart disease next. Dr. Courtney Jordan Baechler serves as the medical director for the Minneapolis Heart Institute Foundation's emerging science centers, including women's cardiovascular research, prevention, and global outreach. She is a preventative cardiologist at Minneapolis Heart Institute who is passionate about a healthy state of well-being that includes body, mind, and spirit. She is a national leader in integrative medicine and wellness. Dr. Jordan Baechler previously served as the Assistant Commissioner for Health Improvement for the state of Minnesota and also helped grow and lead the Penny George Institute for Health and Healing at Allina Health. She has served on the National Prevention Committee for the American College of Cardiology and the Minnesota Department of Health State and Prevention of Cardiovascular and Stroke Committee. We're so excited again for this next presentation on mental health and heart disease. I'm going to turn it over to Dr. Courtney Jordan Baechler.
Good afternoon. I'm Dr. Jordan Baechler, and I'm here to talk to you about mental health and heart disease. So let's get started. I want to start with some of how the heart is talked about in history and literature for centuries. We always talk about the heart in books and poetry. And so here we go. The heart of stone, heart of a lion, someone who is courageous. Heart and soul, someone who's well connected. Wear your heart on your sleeve, someone who perhaps lets you know all of their feelings. The heart of the city, right? We talk about the busy area of the city, the part of the city where the arteries come through, winning someone's heart, having a big heart full of emotion, and breaking one's heart, which we'll talk more about. Speaking from the heart, someone who's authentic is 100% of them. I want to start here with ancient wisdom. Many of you know that we take the Hippocratic Oath when we finish medical school, and this is by Hippocrates himself. You ought not to attempt to cure the body without the soul. The cure of many diseases is unknown to physicians because they disregard the whole. I love this quote because it emphasizes the fact that we can't separate the head from the body, that we truly are whole beings, body, mind, and spirit. And of course, this is true with mental health and heart disease as well. So let's talk about what we know. As I was preparing for this, specifically looking at aortic health and mental health, you may or may not be surprised that there's not much research in this area. A lot of the research we have is based on other diseases of the heart, but here's what we know. 1 in 3 older age patients has depression prior to undergoing a transaortic valve replacement or a surgical aortic valve replacement. And we found that those patients had higher rates of mortality, both short and long term, after their surgeries and aortic procedures. Preoperative anxiety is a predictor of major morbidity and mortality in ages greater than 70 for folks having cardiac surgery. So again, we know that the importance of assessing and knowing and optimizing someone's mental health before they have surgery is important to avoid subsequent morbidity or mortality or death and complicated illness. We know that there is significant improvement in anxiety, depression, and quality of life at about 2 to 3 weeks post-operatively after having a surgical aortic valve replacement. So again, this idea that the procedure itself can potentially help with anxiety and depression and quality of life. We know that new onset in depression is common in survivors of acute aortic dissection. And I think that's important to point out. That's often very traumatic for folks. And if we don't deal with the emotion and understandably the fear that comes from emergency situation like that, we can see new onset depression and anxiety. And while this is the mitral valve, we think of it kind of as a cousin of the aortic valve. Asymptomatic severe mitral valve had improvement in mental health with early surgical repair. This was research done by Serrano out of Mayo Clinic. And that's interesting because this is normally at a physiologic stage, symptom-wise, and also with the heart health where we wouldn't intervene. And we found that intervening early actually improved the mental health of the patient. So as you can see from these questions, this kind of begs the question, chicken or egg, what comes first? Did the mental health challenges come first and then produce heart disease, or did the heart disease come first and produce mental health conditions? And in fact, the CDC has put out this slide, which I just love, that has that same question around the chicken and egg theory and which came first. So we've got anxiety, depression, chronic stress, post-traumatic stress disorder, or PTSD. That we know there are physiologic pathways, pain, fear, increased cardiac reactivity, reduce blood flow to the heart, and increase cortisol that can subsequently increase your risk of stroke, heart failure, cardiovascular disease, metabolic disease, coronary artery calcification, and heart attack. And similarly, those same heart diseases, like we talked about, stroke, heart failure, cardiovascular disease, et cetera, have behavioral pathways that can potentially lead to medication non-adherence, smoking, physical inactivity that can lead to the behavioral health side. So which comes first? And again, the idea, as you see in this picture, that it's all connected. So again, things that we know from the literature, there are certain heart conditions that are impacted by poor mental health. I would argue that we know just about everything is impacted by poor mental health. But as seen here, high blood pressure, heart rate variability, cholesterol, coronary artery blockages, congestive heart failure, obesity, nutrition, and physical activity all have associations with poor mental health. We also know there was a great study, the InterHeart study, that was in 52 countries, 6 continents, that showed psychosocial factors, including depression, stress, anxiety, anger, and social isolation, accounted for 32% of the cardiovascular risk for coronary artery disease. So a third of all coronary artery disease was related to psychosocial factors. These psychological disorders and personality characteristics have been shown to have a negative impact on cardiac health. We know depression prevalence is 3 times higher in our cardiac patients. And we know cardiac patients have increased risk of experiencing emotional distress and impaired quality of life compared to our general population. I love this slide because sometimes as a working mom, this is what I feel like on a day-to-day basis. 70 to 90% of all visits to healthcare are related to stress disorders. So we know it's different for everybody in terms of what they feel, but in this case, you can look at the cardiovascular system and see, though the print is quite small, physiologically how we know that stress impacts the heart. And we're going to talk more about this in subsequent slides. For other people, it may be that mental health and stress impacts their gut. Some people talk about feeling butterflies when they feel nervous, right? That's essentially the physiological side effect in their gut. Some people get pains in their upper back when they start to feel stress from a long week. It's in their shoulders, etc. So again, these physiologic paths are very clearly defined. I would be remiss not to mention women's mental health statistics, particularly because unfortunately, as it relates to cardiovascular diseases, including aortic health, we see differences in women's outcomes compared to men. Unfortunately, they're not as good. So here with mental health, we can see how that may be a part of it. Each year, 1 in women has a mental health challenge, so 20% of women. Depression is 2 times more common in women. Women are 2 times as likely to experience post-traumatic stress disorder or PTSD. Women are 2 times as likely to experience generalized anxiety disorder. And women earn less than men who work full time. So women earn about a quarter compared to their male counterparts, a quarter less compared to their full-time male counterparts. And also 65% of caregivers are women, whether that's for children or adults or other family members. So we know that women have a lot on their plate to increase the likelihood of poor mental health outcomes. So we've been talking about this physiologic pathway. What do we know? What happens to the body with stress? So again, this is working off of data that's been around a long time. This is a quote from a physician, William Harvey, in the 1600s. A mental disturbance provoking pain, excessive joy, hope, or anxiety extends to the heart, where it affects temper and rate. And sure enough, that's exactly what we have. So we know when the body experiences stress, it increases what we call our sympathetic nervous system response, which is known as our fight or flight response. That leads to an increase in blood pressure, an increase in heart rate, which subsequently then increases our blood sugar, our insulin, and overall it increases our inflammation. In fact, it feels like we have a tiger chasing us, right? And while from an evolutionary perspective, this was a good thing, we didn't want tigers to be chasing us, or we wanted to be able to get away from those tigers. Now we're talking about kind of everyday stress and unfortunately still having that physiologic response. So there is in fact a syndrome of exactly this with the heart. It's called the broken heart syndrome, or Takotsubo's, which was the Japanese word for stress-induced cardiomyopathy. So what we see is this particular occurrence after somebody has gone through something extremely stressful, death of a loved one, a divorce, bankruptcy, something very, very stressful for them. And we know that the individual will have a surge of stress hormones. They usually come in with intense chest pain to the emergency room that looks like they're having a heart attack. We often rush them off to the catheterization lab to look at their coronary arteries and make sure they're not having a heart attack, because again, it looks like that when they present. We subsequently find that they have normal coronary arteries, and when we look on echocardiogram, it looks like there is their heart is beating such that it was described as looking like an octopus is in their heart, which is where the term Takotsubo came from, again, from the Japanese. It's more common in women. It's more common in women over age 50. And again, this can produce heart failure or cardiomyopathy. And so it just speaks to this brain-heart connection that we know is such a big part of how we look at the heart in general. And this is one physiologic way that has been shown to be exactly that. So again, thinking about the world that we're living in, I think it's also important to talk about the coronavirus and the impact that's had on mental health, and again, subsequent potential delay in care from a cardiac perspective. This was actually done back in the beginning of COVID. And you can see, just as we polled people, and this was a Washington Post poll, that people are feeling stressed by this. People are worried. It's a significant source of stress, and it's disrupted people's lives a lot. And I just put this in because part of what we're going to talk about towards the end of my presentation is ways to reduce stress in your life, ways to improve your mental health, which is a critical piece. And here we go, starting down that pathway. So lifestyle medicine, I think, is an important piece to think about. So, we've talked about all these different pieces of mental health, from stress, anger, social isolation, depression, anxiety, schizophrenia, bipolar. All of these things are a part of the mental health category. So some require medicine, and some are going to, in addition, require lifestyle changes. And lifestyle medicine is only going to help with the neurohormones that our brain is producing to tell our body it can be calm, it can experience joy, etc. This was from studies that were done back in the 80s by Dean Ornish, looking at whole foods, plant-based diet, stress management techniques, including yoga and meditation, moderate exercise, so walking, not high intensity interval training that for many, from an aorta perspective, we're not going to be recommending those high intensity activities anyway. And then social support and community, so love and intimacy. Again, not necessarily sexual intimacy as much as feeling that you can be yourself with somebody, back to the metaphors that we have, wearing your heart on your sleeve, etc. So there is an example of a whole foods plant-based diet, but just would encourage folks to look at whole foods are going to be so healthy, and nutrition is one of the best ways that our body and mind on a 3 times a day or however often you're eating can receive information to know you're safe. And in fact, Dean Ornish in 1990 did a trial looking at that lifestyle heart program and whether or not it could reduce heart disease and actually reverse it. And in this case, you can see these folks were on a 1-year intense program looking again at that plant-based diet, walking, stress management, smoking cessation, and group psychosocial support. And we don't have to go through these numbers, but the bottom line is the plaque or the coronary artery disease that they had in their arteries regressed. It actually improved, and that was sustained at 5 years. It improved even further. Meditation is another thing that you might hear lots about. So Transcendental Meditation is kind of the one that is most well studied. It's kind of the most hardcore, if you will, but we've done studies with as small as 5 minutes of meditation and what a difference it can make in your body. So here are some of the larger cardiovascular trials that have shown reduction in cardiovascular risk factors, morbidity and mortality, randomized controlled trial looking at meditation versus health education, showing improvement in insulin resistance. So again, decreasing your risk for diabetes, autonomic tone improvement, reduced atherosclerosis or plaque measured by carotid intima thickness, so in the neck there. And then there was also reduction in mortality in patients that had cardiovascular disease who were randomized to meditation compared to the control group. So that was huge. And I specifically like this trial that was done by Schneider in 2012 that showed a 48% reduction in our African-American heart patients, all-cause mortality or death, heart attack, and stroke. That's a big deal. And again, I think that when we know that unfortunately our African-American patients have different outcomes than our white patients, that is not driven by race and is actually probably driven by racism and access to care and all sorts of other challenging pieces. It's great to know that something like meditation perhaps allows the body to take a little of that less in physically. So look at what you can add to your life. Guided imagery. This was a trial that was done at Abbott in 2006 by Dr. Kashetri, one of our cardiovascular surgeons. Perhaps some of you have valves and aortas that were repaired by Dr. Kashetri. So this was in partnership with the Penny George Institute for Health and Healing, and we looked pre and post surgical intervention. So we had folks listen to guided imagery before they went into surgery. And for those of you who haven't done guided imagery, I would have you Google afterwards guided imagery. There's lots of free stuff on the internet that's fantastic. And basically it's a way for you from a sensory perspective to take yourself to another place. So when I do guided imagery, especially on a day like this in February, where it's quite cold on the day I'm recording this, I take myself to a beach in Hawaii and I think of what I smell there, what I taste, what I feel, what I hear, the crushing of the ocean waves, the sand in your toes, maybe the salt from the ocean popping in your mouth, the sunshine, the clouds, etc. And what we found is that pain and anxiety were decreased significantly post-surgery, simply in the patients that had guided imagery before they went into the surgery itself. And by augmenting pain, we were able to decrease the length of stay by 2 days. Biofeedback is another option. There's some great opportunities to do this on your own if you don't want to go in and have it done using a process called HeartMath. So that's something that you could look up. And what it's doing is it's monitoring your physiological function, your muscle tension, your skin temperature, your heart rate, and respiratory rate. So you're hooked up similar to what you can see in this picture, but like an EKG, only in this case, you're going to be hooked up to facial probes that allow us to measure these things that I just mentioned. Then you're taught deep breathing and muscle exercise, relaxation. And basically what's happening is you're learning how to reduce that sympathetic nervous system response and increase the parasympathetic nervous system, which just allows us to lower blood pressure, lower stress, and it's also been shown to increase heart rate variability. Tai Chi is another one that's been very well studied. I think of this as kind of, somewhere in the yoga family, kind of a moving meditation. This particular trial was done in heart failure patients. So they had heart functions less than 40%, ejection fractions less than 40%. And they were randomized to 12 weeks of Tai Chi or usual care. And the ones that did the Tai Chi had a statistically significant improvement in their quality of life, 6-minute walking distance, and a reduction in their serum brain natriuretic peptide or BNP, which again, these are all measurements that we normally do for our heart failure patients. So to improve them, very good correlation with improvement in the overall outcome for these patients. So Tai Chi is something that you don't have to have a lot of space for. You don't have to be a super athlete. Be another one that there's lots of free Tai Chi available online. This was a study I was involved in at the Courtney Jordan Institute where we looked at integrative medicine after people had had cardiovascular procedures at Abbott again. And it was a 1-hour intervention. It could have been anything in that integrative medicine bucket. So that could be acupuncture, that could be some of the biofeedback we talked about, it could be massage, aromatherapy, all sorts of things. But you can see we had a 46% reduction in pain, about a 55% reduction in anxiety. That was in a 1-hour intervention pre and post. So very powerful. We subsequently published that of just how effective these can be in utilizing integrative medicine in the hospital. I want to emphasize sleep. If you take away nothing else from this talk, please think about sleep. 100 years ago, we averaged 8 hours a night. These days, most people average 6. And what we know about chronic sleep deficit is it leads to weight gain, more immune compromise, which we need our immunity right now more than ever in this pandemic, less restoration, and more inflammation. And it's going to have a big impact in, again, our brain's ability to produce those neurohormones that are going to help us have joy, happiness, calm. So this is one of my favorite quotes, particularly as a cardiologist. Peace, it does not mean to be in a place where there is no noise, trouble, or hard work. It means to be in the midst of all of those things and still be calm in your heart. What I want to emphasize is that I appreciate, for a variety of reasons, you can't get rid of stress in your life, but what we want to do is manage how your body responds to that. And that's a part of, again, exercising these muscles to minimize the impact that the stresses are going to have in our life. Part of that comes with social connection. I appreciate that that's different now in COVID, but we know as human beings that there are studies that we're meant to connect with other human beings, and people who routinely socially connect live longer and feel better. And so definitely before COVID, I routinely would write scripts for my patients saying, you need to connect. You need to be seeing people that you can be authentically you once a month or whatever that means. So again, we got to do it safely during COVID now, but figure out what that means. It's a huge piece of the puzzle. I put this in here. This is my daughter, Sophia. She passed away unexpectedly 5 years ago. And this was her at her kindergarten Valentine's Day party. And we're nearing or passing Valentine's Day when this presentation will go to you guys. But again, I say this because this is coming from a place, from a person who truly understands tragedy, the potential for PTSD and poor mental health outcomes, and what a personal practice it has been for me to incorporate some of the things that we talked about in my life every day, just to make sure that we can all have the best lives, the fullest lives that we are possibly able to have. So I get it. I want to make sure folks understand that I appreciate trauma. So I would just encourage you all to take action. I hope these slides have been helpful. I'll be looking forward to answering some questions later when we have a little opportunity for some Q&A. Thank you so much.